I'm David Phillips. I am the manager of operations for ArcLight Medical. I am primarily responsible for our community-based care program. And the concept is to care for the patients in place such that they don't need to go to the hospital. In general, we're seeing a move that way in healthcare, largely supported, very strongly supported by technology. We're able to do more and more diagnostics now remotely that used to only be done at the hospital. We can communicate very, very effectively with other clinicians using the mobile technology we have. And we can communicate effectively with the patients themselves without even being present in some cases. Technology has been critical for us, and it's been that way for years. We use a couple of tools that it turns out are pretty important. Some of them are mechanical. For example, no longer do we simply have to pick people up. We now have devices on the ambulance vehicles that lift patients in a much more safe manner and can lift a much heavier patient than we could ourselves safely. We certainly use communications technology extensively. For example, our communications back and forth to dispatch, although we also use radio, they're not even a radio in the normal sense anymore. They are an LTE product that gives us enormous flexibility. For example, those things have built-in GPSs. We send assignments to people electronically through mobile devices that include technology such that not only do they get the information about where we need them to go and what we need them to do, if they touch the links in the message, it brings up the patient's chart. It brings up a photo or an image of the house. It brings up the last notes from the last person that saw that patient. It allows them simply with a touch to tell the dispatcher that they're on the way, to tell the dispatcher they're there. COVID now has fueled the development and the distribution and the licensing, the permission by the government to use these other tools like telemedicine, and we use them constantly. So our field medics can immediately bring a physician up on a video call using the simplest of devices. The technology is such that it's encrypted, protected, recorded. We can send an image of a wound, and the physician from someone's living room with just regular cell phone coverage, the physician can see the wound at a high enough detail to make a diagnosis of it. ArcLight is the company that administers and manages and owns the community-based care program. Shurmed is an ambulance operator, but more than that, it's an out-of-hospital care company. We care for many, many, many hundreds of patients here in the San Antonio area who will never see a stretcher, and they won't go to the hospital because we're going to take care of them. And we're doing that with paramedics primarily, a mix of other providers, including some nurses. Both companies are small business veteran owned. The primary owner was a longtime Army officer, and partially because of that, partially because of the organization's cultures, and also certainly our location, we have a very, very large veteran employee base. Probably 50% of our employees are veterans. I believe that technology and medicine are continuing to move toward a more distributed model. I think that less and less care will occur at a facility. This is the deep concept that's so important to us now in healthcare, is distributed out in the community. The patients aren't coming to the care is coming to the patients. And we did that with technology.